Good morning and thank you for joining us. Our news conference will start in just a few seconds. Good morning and thank you for joining us. Our news conference. Hi, I'm Lacey Nobles with the City of Lubbock, and we thank you for joining us this morning for our news conference. We will cover many updates today with our panelists, Director of Public Health, Catherine Wells, Local Health Authority, Dr. Ron Cook, and Lubbock Mayor Dan Pope. So let's get started with Catherine Wells.
Good morning, everybody, and thank you for being here today. Today I'll update you on my weekly numbers count of COVID-19 as we move through this epidemic. The health department is reporting 9,075 cases as of yesterday evening. This is a significant jump to where we were 2 weeks ago, and we continue to see a record number of cases in the community reported each day. The health department is closely monitoring case counts and patterns of disease, and this is really the goal when we talk about contact tracing, and we will continue to trace, contact all individuals who either test positive for COVID-19 or are close contacts. We are also working a lot with our businesses, schools, and property owners to mitigate risk, and especially when we identify any hotspots. Overall, the spread of COVID within the community is really tied back to unstructured gatherings. These are such things as like a house party where masking and social distancing is not followed. This weekend, we look forward to our first football game. While it's great that we'll be able to enjoy some of our fall traditions here in Lubbock, which isn't the case in all communities, we really do need to be mindful that there is significant virus circulating in the community. I know everyone wants to get together, and this can be done, but we can't do the things the way we did them last year. It's much better to have a gathering outside than one inside. Encourage everybody to bring their own food and drink so that you're not sharing. Make sure people are wearing masks and keep your gathering sizes manageable. This is so if someone tests positive, we can do the contact tracing and are able to figure out everybody who might have been exposed. If we can do all of these things, we can move on and have multiple football games and really enjoy some of those fall activities. But again, it's going to take us as a community to work together and all follow the same rules to be able to do these things. Now I'm going to turn things over to Dr. Cook. Thank you.
Thank you, Catherine. I appreciate that. As Catherine mentioned, our numbers are certainly increasing here. We have 650 cases, active cases on the Texas Tech campus. We have 2,521 in Lubbock that we're monitoring. So when those contact tracers call you, we're just trying to stop the spread. So please be as honest and forthright and forthcoming in the information that you give us so we can stop this disease spread. We've increased our testing on the main campus. We're grateful for Texas Department of Emergency Management. They have been very helpful in trying to get set up our testing capabilities so we can continue to try to stop this virus. As Catherine also mentioned, most of the new positives are in the age group of 18 to 24. So how do we stop that? We've got to avoid the big parties. We've got to avoid the big house parties and the big pool parties and avoid other social events where there's great big gatherings. You must wear your facial covering and certainly keep your social distance. The next thing I want to visit with you about, how do you live in an apartment or how do you live in a dorm room and not spread the virus? One thing you do is do your best to avoid that close contact. Keep that 6-foot bubble around you. You got to make sure that you wear your mask when you're in common areas. Avoid sharing food, avoid sharing drinks with roommates, and certainly in the apartment or in the dorm room, if you have a common bathroom, make sure, use your own hand towel, use your own toothbrush, and make sure that you keep that toothbrush off the sink. Keep it in a glass or a cup where it's not touching the sink itself. You know, Texas Tech and the other colleges and other universities in town have gone to great extent on trying to keep social distancing, marking off 6 feet in classroom, so you're not close to anybody. Wear your mask when you're on campus. Wear your mask when you're in the classroom. Disinfect the seating area where you're around. Clean up when you leave. Wipe it down again for the next person. What about dining halls? Most of the dining halls are set up where there are no buffets, but make sure that you get your lunch and leave, or get your box lunch and leave. And if you do sit in the dining hall, make sure you keep that distance further away from you. Certainly don't share drinks, don't share utensils, that sort of thing. And then if you do go downstairs into the laundry rooms or laundry room complex at your apartments, make sure that you use strong soap to clean your facial coverings. You ought to change those facial coverings every day. Certainly sooner, more often than that, if it becomes soiled, but change a mask every day and then wash them in hot water and soap. Soap kills this virus. It kills that lipid layer, that fat layer surrounding the virus. It breaks that down. That's the whole purpose of soap, and it'll kill the virus. And then the last thing, you know, it certainly feels like fall outside today, right? It's nice and cool. The wind's blowing. That's what fall feels like in Lubbock. It certainly feels like football weather, right? We want everybody to have a good time this weekend at the football game, but there are things we must do. We must be safe. We must keep our social distance, and we must wear facial coverings all the time. That's all that I have, other than get your flu shot. We don't want you to get both diseases at the same time. We don't want anybody to get disease. Thank you so much. Mayor Pope, I hand it off to you.
Thanks, Dr. Cook. Good morning, everyone. Let's start with data today, and then I'll make a few comments. Okay, so we'll start with maybe the worst news first. Our positivity rate has changed significantly over the last week. We were pleased last week to announce that we'd kept it in single digits for a week, and with the number of cases we've had, but more importantly, the spread among close contacts, you can see our positivity rate has jumped up significantly. This is a number we'll keep watching. It's something that's very important that we get this down. This is a leading indicator of the way we're controlling spread in our community. Hospital number continues to improve. Less than 60 inpatients as of yesterday, and only more than half of those not in ICU. So it continues to be positive. It's something that we're really watching, and you'll see in a minute. I'll tie this back together with the new cases and the demographics around those. So it's good news here. Nearly or more than 4 times as many recovered as active cases in our K-12 age group. So a good trend here. So new slide. This is our case status for the 18 to 24-year-olds, and you can see that we have more recovered than active, but a big majority of our active cases are in this range, and this final slide points that out. I guess and this is sort of your Captain Obvious kind of slide, but 1,392 cases in the demographic between 18 and 24 of the last 2 weeks. The total of all other positive cases in the same 2-week period is just over 700. So nearly twice as many in this group, small sliver of our population, than all other age groups doubled. We know where the problem is. So it's critical that we control this spread, and it's manageable. We've proven that among every other demographic in our community. I'll end my slideshow and go to my comments. I'll start my further comments just by pausing to say that I full of sorrow and empathy for the families that have lost loved ones or that are continuing to battle with COVID-19, and certainly the impact it's made on our families and businesses in our community. I'm excited about what's coming this weekend from a football standpoint. But before we get there, let me talk about a couple other things. One, testing. Testing is abundantly available in our community. It's free Monday through Friday from 10 to 4 at Rogers Park. That's that's at in the gymnasium there. Walk up, drive up, no appointment required. Once again, it's free. That's on Auburn, in the 3200 block of Auburn. That's 2 blocks east of Indiana, north of 4th Street, sort of due east of the Rawls Golf Course. Okay. Also, on the Texas Tech campus, that they had walk-up testing over the weekend in Urbanowski Park. They've shifted that over to United Spirit Arena for a couple days. I think it'll probably go back to the park at some point once the weather cooperates. But once again, free, no appointment required, focused on students at the United Spirit Arena. Both of those are being operated by Texas Department of Emergency Management, and I echo Dr. Cook's words of thank you to them. The governor, either late last week or early this week, I can't remember exactly what day, extended his disaster declaration. So those of you that are asking about what may change, nothing as it is right now. So same occupancy on our restaurants, same restrictions on our bars, and certainly same restrictions on large events. Recall that any large event over 10 requires you to contact our office. We'll let you self-certify for your event if it's from 10 to 49 people. Anything above 50 or above, you need to go through a process of delivering us your safety plan, and we'll review it, make some suggestions, potentially work together on it, and then approve it. Now, we are spot checking these events. The vast majority of these events are going very well. We have reason to believe that there are a couple of those that maybe the compliance was not exactly what we expected, and we will be taking steps to address that. It's our responsibility to do this. It's something that we take very seriously. Let's use that as a segue to football this weekend. There have already been 3 Big 12 games postponed or canceled. The SMU-TCU game, the Baylor-Louisiana Tech game, and the Oklahoma State game, I believe, with Tulsa. We don't want to find ourselves in that situation. And this is a place where I've got to ask for the help from college students. I know you feel bulletproof. I know you know that you're not likely to end up in the hospital if you become positive with COVID. However, your decisions have implications on your peers, and they have implications on our community, and potentially anyone that you might run into if you are carrying this virus asymptomatically. Tailgating before the game Saturday is a big part of our tradition. It's something that I really enjoy. We've got to do it smartly. We've got to do it the right way. We are permitting and approving off-campus tailgates on a game-by-game basis only after we've seen and worked through a safety protocol for the tailgate. We've got to do it right. We know of too many examples where these type of events have been party to significant spread. Okay, let's do this right. Let's get through this rough spot that I believe is associated with coming back to school. If you look at the rest of our population, we're doing a very good job. Face coverings are working. Social distance is working. We're making the right decisions about who we hang out with. This is doable. We've proven that. We've got to do it the right way. It's sort of a West Texas kind of Lubbock common sense approach. So I'm optimistic. I believe there is a path to a day-to-day life that we better recognize, but it takes all of us working together to get there safely. It's a responsible and rational effort, and it's certainly something that we can do. I look forward to answering your questions. Lacey, back to you.
Okay, thank you, Mayor. We're going to open it now for media questions. We've had some changes, so here is today's media question order. We have Texas Tech Public Media, Fox 34, Telemundo, KMAC, KLBK, the Avalanche Journal, the Daily Toreador, and Latino Lubbock. So let's get started with Sarah Self-Walbrick from Texas Tech Public Media.
Hello, everyone. I want to start. Many other Texas school districts have returned to classes this week. Now that we're a few weeks in here in Lubbock, how are things going in our K-12 schools? And what could other districts learn from Lubbock's experiences?
Catherine, you want to start with that? And then maybe Ron and I can add on.
Sure. Some of the things that I've seen that are going really well is seeing even our littlest kids wearing masks in the classroom, seeing lots of compliance with masking with our teachers. I think parents are doing a great job of keeping children home, even if they have a little sniffle or a slight fever, just to make sure that we don't spread any virus within those communities. I'm really proud of all of our school districts. We've had lots of great coordination between them and the staff at the health department. We're in communication with all of them daily.
I agree with Catherine. We've had very few reports from K through 12, and so they're doing a great job. Their school nurses are staying on top of things, and all the teachers are doing a good job. And I compliment the parents, as Catherine said, for making sure that the children are wearing their facial coverings and also letting us know and when something comes up that we need to address.
I agree. I think we've shown the way. I think we've proven that we can do it safely. I think the superintendents and their teams continue to make decisions as they learn on a daily basis. And I'm thankful that our kids are back in school face to face. That's what I'm hearing from parents, that even those that were reluctant to send kids back to school, I think now in the fourth week of school are starting to feel comfortable with the experience.
Thank you. And then this is a more personal question, but I am curious. Mayor, I know you live in the Tech Terrace area. I'm curious to know if you've seen some of these reported off-campus parties and kind of what's happening in that neighborhood, in particular, where we do have a large student population. Anyone else is welcome to chime in too.
Well, I'm going to, Ms. Wells is younger than I am. And she also is she's one of my neighbors, and she, I think, has a little better experience. I was joking this morning that about the time I go to bed, the college students are getting in the shower, getting ready to go out. So I've not experienced anything firsthand. I've heard from neighbors. Catherine, you want to add to that?
I mean, that first weekend before school started, honestly, I saw some very large house parties, and, definitely think there's some spread associated with those. We called the, LPD non-emergency line, and some of our officers were able there to educate those students. And really, it's about keeping the size of the party small. When we go and do contact investigations, it's really hard to work with a positive and they say, I went to 3 or 4 different parties in one evening. If we could get people to stay in the same spot, stay with people that they know, that really reduces the spread of the disease.
I think what Catherine wanted to do is break into the Dolly Parton song 9 to 5, where it says 2 doors down. They were laughing and singing, dancing and singing and having a party. I think that was Catherine's experience.
Okay, great commentary. Thank you.
Okay, thank you, Sarah. Now we have Brady King with Fox 34.
Good morning, everyone. For Dr. Cook or Catherine Wells, for all those cases in younger people and college-age students, how severe have the symptoms been? And then is there still a concern, obviously, that the college-age groups are not as worried about transferring a case to someone older if they're living away from family?
Thanks, Brady. You know, in this age group, they will get sick. They're not going to feel very good. It's going to be, you know, a bad viral syndrome, muscle aches, headaches, maybe some nausea and vomiting, maybe some diarrhea. So most will have some of those symptoms. Some may get off and not have any symptoms, but there still are a moderate amount. Just because you're 18 to 25 doesn't mean that you cannot get sick. You can become severely sick. If you look at the statistics, there are some people that pass away in this age group from the disease. It's relatively minimal compared to our older and vulnerable patient, I should say, more experienced patient population. But there are individuals, I was on campus the other day when we had to call for an ambulance to go out and help somebody out in one of the dorms. So there are sick students, and so should not take it lightly. You never know if you're going to be the next one that won't do well with this virus. That's the whole thing about wearing a facial covering. You don't know who you're going to give it to if you don't wear your facial covering, and you don't know how well or how poorly they might do with this virus.
Thank you. That's all I have.
Thank you, Brady. Now we have Yahaira Hernandez from Telemundo.
Thank you, Lacey. Good morning, everyone. So my question would be for Dr. Cook. With the transition from warmer temperatures and now getting these colder temperatures today and yesterday, would that bring in more chances of getting sick? Is there a plan to face both the flu and COVID-19?
Yes, it's as people move indoors, the closer the proximity people are going to be, which let me just give everybody the precaution as we move inside. You know, a lot of people don't like being outside in the cold. Nobody really does. And so we move inside, and that means more people in the confined space, which means more likely to transmit the virus to somebody else. Again, all the more reason to wear your facial covering, keep that 6-foot distance between you and somebody else, and watch the number of people in a given room or facility or building to make sure that you do keep your space. Don't feel embarrassed that if you feel uncomfortable, you should leave. Say, hey, this is too tight for me. I need to move on. I need to go find some other place to visit with where there's less people and I can keep my social distancing. We can stop the spread of this virus, again, by social distancing and facial coverings. And as cold weather comes in, we're going to move indoors, which is going to more than likely propagate the virus.
Awesome. Thank you so much. I do have another question. Why are we seeing a drop in hospitalizations despite the significant increase in active cases?
Thanks. That's another good question. So it takes time for this virus to spread. So before schools started, people were doing a great job in keeping their social distancing, and we started to see our numbers come down. And so there's a very strong likelihood it's a second surge because our numbers are going up, and those individuals may not be very symptomatic, or they may do well with the symptoms that they have, but there's a likelihood that they will spread it to somebody else in their activity and interactions with other people outside the young population. They still have to go to the grocery store, they still have to go shopping, do those sorts of things, and you may spread it to somebody else that may not do as well. So all that to say, it's going to take a couple more weeks, maybe 3, before our hospitalization numbers may increase again. We'll just have to wait and see.
Yeah, it's a lagging indicator. That's how you would, if you're talking stats.
Okay, awesome. Thank you so much. That's all I have. I appreciate your time.
now we move to KMAC with Matthew Still.
Thanks, Lacey. Two quick questions. First question for Mayor Pope. Mayor, you mentioned that the city is going through some approvals for off-site or off-campus tailgating. Tell us, what do you guys and what is the city looking for for someone to get approval? What are some of the protocols and safety procedures that would allow somebody to get approval from the city?
Well, we're looking at the items we've been talking about through the entire pandemic, Matt. So we're going to talk about occupancy, total number of people in the space they have, how they're willing to limit that. We're going to require face coverings. We're going to require, we're talking about temperature checks. We want to make sure they have room to do the kind of distancing. Ideally, I think we'd like it to be where most people are seated and not up milling around. So those are the type of things that we're going to look for as we evaluate those plans.
Gotcha. Same question is for Dr. Cook. Dr. Cook, we heard Mayor Pope earlier kind of give a plea to those between the ages of 18 and 24. From your medical standpoint, medical professional standpoint, can we kind of hear from you on why the spread needs to stop, or why we should somewhat stop that spread within that age group, and why it's so important to do that now?
Matthew, those of us that were fortunate to go to college, we make some lifelong friends there, and it's a very social institution. And so I think people want to get together. They want to see their friends if they're upperclassmen and see their friends from the previous years. And always the beginning of school is always a little bit more popular with parties and that sort of thing that occur. And then the attitude is, I'm not going to get near as sick as my grandmother might. So it's better that perhaps I get it here and not take it home. And so get over it before I go home for spring break or Christmas break or something like that. So we shouldn't have that attitude. And again, it's always about caring for somebody else. Wear your facial coverings because we care about somebody else. It's not really, I'm not trying to prevent anybody from doing anything, but just have respect for the other person. And that, you've entered, if you go to college, you've entered the professional world in many ways. And this is a way to start that professional career and lifestyle sooner, just by wearing a facial covering in this age group. Of course, that goes for anybody, just anybody in general. We got to wear our facial coverings when we're out and not in our households.
Thank you, Mayor.
Okay, next we have Terry Furman with KLBK. I don't see her. So Terry, if you get on, raise your hand and I'll get you on. So we'll move on to Matt Dotre with the Lubbock Avalanche Journal.
Thank you, Lacey. Hey, everyone. Ms. Wells, so I understand that most of the cases are 18 to 24-year-olds. I guess in the last 14 days, based on the numbers that the mayor just showed, there's been 90 cases, 10 through 17-year-olds, which I guess are kind of the older K through 12 students. I feel like 90 is still pretty significant. Have there been any micro closures in classrooms? And I mean, have there been any spread within the schools yet?
Well, I'm sure people saw the news yesterday that Slayton ISD is closing for 2 weeks, and that's due to an increase in the number of cases in their middle school and high school classes. We are seeing cases in younger students or student and school-aged kids. The thing we're looking for is actual spread within the classroom. So right now in LISD, we have not had to close down any grades. We have had to quarantine children. That might be a child that's sitting next to a positive child in a classroom. So we're really looking at the individual situations, working with the school system to determine whether or not there are those true close contacts and sending those children home.
Okay, but no entire classrooms so far have been switched.
With the exception of Slayton, I don't know of any.
Okay. And I guess, yeah, I feel like, thank you, Ms. Wells. I guess this question I think is for Dr. Cook. Like, I guess everyone's concern is kind of the ripple effect now. Do you foresee do you foresee trends staying the same where it's all clumped into 18 to 24-year-olds? Or do you kind of, you know, where do you think we're going to be 3 weeks from now? And how do we prevent it from reaching other age groups?
So the ripple effect, I guess what you're describing, spreading it onto other people, is that what you mean by the ripple effect? Yeah,
Yes,
so that it very potentially could happen, you know. So if a person is positive, we truly are a high risk individual. We ask them to quarantine themselves, to stay home. That doesn't mean I'm not going to go to class or I'm not going to go to work, but I'll run over here to the grocery store or run out and get something to eat at a restaurant. When you're quarantined or you're asked to stay home and self-monitor, that means you stay home and somebody brings you things that you need, groceries or whatever. That means you stay home. That's how we stop the spread. If we don't do those things and these positive people continue to mill about in the community, they're going to spread it to other individuals. And then we're going to see other individuals get sick too. That's the ripple effect that you described.
Mm-hmm. Okay, thank you.
Thank you, Matt. Now we have Amanda Hampton with the Daily Toreador.
Hi, everyone. My question is going to be mainly for Mayor Pope. Are there any plans for tightening restrictions on businesses in the city due to the rise in cases?
No.
Okay, and then my second question is, what should students in dorms be doing while they're waiting for getting their test results?
Yeah, great question. Dr. Cook, you want to take that one?
If you heard me earlier, you just need to stay home. Do your online school, your classes while you're in the dorm. The schools and the universities have set up ways for food to be delivered to you, that sort of thing. People should be, you should get phone calls on checking on you to make sure that you're doing okay, those sorts of things. And so if you need something, reach out to student services and just ask for help. We're here to help you. We want you to be successful in your education.
Thank you.
You bet.
Thank you.
Thank you, Amanda. Now we have Latino Lubbock and Christy Martinez Garcia.
Good afternoon, everybody. We've had several folks who've tested positive and still haven't been contacted by contact tracers. What deems a reason to be contacted or not? And are we short on tracers? This is probably for you, Catherine.
Yeah. We are currently contacting everybody within 24 to 48 hours of a test being received. However, I will say that a lot of times we're provided incorrect phone numbers or incorrect addresses, so it is hard for us to contact some individuals. If somebody feels like they haven't been contacted, please call, because you might be one of those people that we've been trying to contact.
I'll make sure to give them the number. We continue to see the numbers reported not only by the city, but also by Texas Tech. And a lot of people are confused about those numbers. And also, I know that students 1824 are transmitters, but just by the information that you shared this morning, Mayor, the spread's across the board. And it implies that perhaps the public is getting too lax. Because if you look, 30 through 39 age groups seem to be on the rise. And that is a population that likes to attend bars and even have parties. So how are you addressing that? Because I know you're not going to have businesses. You just told us that.
Yeah, I think it's a good question, Christine. I think it's a concern we have. I think one difference this time versus what we saw in June after the governor reopened bars was we didn't have a face covering requirement. The masking requirement has significantly slowed the spread. And it's our desire and our hope that we see that happen over the next several weeks. The nearly 1,400 cases, about 100 cases a day is what we've averaged in the 18 to 24 year-old demographic over the last 2 weeks. We know there'll be some spread. We hope that by following the protocols we have in place when they get out of their dorms or out of their apartments and follow the safety protocols that are in place under the governor's order and our orders, that we can limit that spread. But I share your concerns. I think all we can continue to do is appeal to people's common sense and logic and remind them that the virus is very much alive and real, and that has its own set of significant dangers.
Are you still doing mass checks on businesses? Because I've seen a few that really aren't enforcing that, and I know they can't be mandated or enforced, but there's a lot.
Yeah, if we get it's a good question. We still get a few phone calls every week from people that have that same experience. Please call the council office or the non-emergency line at LPD. We go out to visit every one of those. You would be very pleased with the work that I think the community citizens would be, that the work we're doing with LPD and the fire marshal's office and TABC, doing spot checks on our restaurants and bars. And we'll continue to do that. It's important that together with those bar owners, with those restaurant owners, that we provide a safe environment.
Thank you.
Thank you.
Thank you to our media for asking questions. And this concludes our news conference. We thank you for joining us today. Thank you to our panelists, and thank you to our interpreter. Remember, you can find coronavirus information and resources at our website, mylubbock.us/COVID-19. Have a good week.